on YouTube. Okay, if everyone's ready, I'm going to get us going. All right, thanks for joining us, everyone. Today is Tuesday, June 2nd, and you're at another media briefing. Like we promised last week, we were going to down to 2 a week, and here we are. So Tuesday and again on Friday until further notice. Today we have statements from 2 of our panel members. We're going to start today with Regional Chair Karen Redman, followed by a health update from Dr. Hsiu-Li Wang. And Mike Murray's also here to answer questions if needed. So without further ado, I will pass it over to Chair Redman. Go ahead, Karen.
Thank you, Bethany. We at the region are saddened by the global chaos, loss of life, pain and suffering of all those impacted by the events happening south of the border. We know there is still work to do locally as well. We must all continue to challenge and eliminate systemic racism and all forms of discrimination. Our strength in Waterloo Region is our collective differences. I believe we are a community that genuinely cares for one another, and we at the region are committed to offering programs that continue to foster healthy, safe, and inclusive communities for everyone. In honor of Pride Month and our LGBTQ community, we are flying the Pride flag at our regional headquarters to celebrate diversity and promote inclusion. June is also Seniors Month, and we are participating in a campaign launched yesterday called Stay Safe, Lead the Way. It's a campaign designed to keep older adults safe, healthy, and connected throughout the phases of COVID-19 pandemic. Although all age groups are at risk of contracting COVID-19, older people face significant risks of developing severe illnesses and are at a greater risk of social isolation and fragility. If you or someone you know is in need of help or services, visit www.caredove.com. Regional councillors and myself are pleased to hear that the federal government announced some rush funding to help municipalities like ours whose revenues have plummeted because of the pandemic. We're getting money we typically receive from the federal gas tax program early this year to help ease budget concerns. While the $2.2 billion will help Canadian municipalities provide essential services, we continue to support the Federation of Canadian Municipalities' appeal for at least $10 billion in emergency funding. The region's revenue shortfalls are totaling approximately $4.8 million per month during this pandemic. The early release of the money will help in the short term, and we're encouraged to hear that there are plans for more. We're committed to keeping essential services running when people need them the most. Thank you.
Thanks, Karen. I'll pass it over to Dr. Wang. Go ahead, Hsiu-Li.
Thank you. Good morning. After several days of low numbers of new cases, we saw a bit of an increase since yesterday. This is what I thought might happen with the increased testing volumes that we've seen lately, and we'll have to monitor the trend. We are seeing greater stabilization and control of outbreaks in long-term care and retirement homes. That said, we are now detecting outbreaks among workers in workplace settings. This is not unexpected as COVID-19 continues to circulate in our community. I expect as more workers return to work and testing continues to broaden, we will detect more cases among workers. Regarding these workplace outbreaks, the outbreaks we have detected to date are not in workplaces that are open to the general public. If there is an increased risk to the general public, due to a workplace outbreak, we will provide public notification. Otherwise, we will list the outbreaks by general type of workplace in aggregate form on our website on the Outbreaks page of our dashboard. The Conestoga Meats outbreak, which was declared over last Friday, and its total of 91 cases, has been integrated into this table that now appears on our dashboard with aggregate data. In these outbreaks, workers are notified, and public health works with the Ministry of Labor, which has oversight over workplace health and safety, to investigate and ensure the implementation of appropriate measures to bring the outbreak under control. The numbers for these outbreaks will be updated on our dashboard every Tuesday and Friday. In closing, now is not the time to loosen our adherence to public health measures. We all have responsibility for one another. We all have to be mindful that we must continue to protect our families, our friends, our neighbors. This is why I continue to urge people to practice physical distancing, to wear a mask when you are in close proximity to others, to practice good hand hygiene, and to stay home and get tested even if you only have mild symptoms. The numbers on our dashboard tell us that we are not out of the woods. To continue with our progression, we must remain vigilant and we must continue to protect one another. Thank you.
Thanks, Dr. Wang. We can get started with media questions, and I will get Kate to kick us off. Go ahead, Kate.
Sure, I'm going to start with Dr. Wang. There is a march planned tomorrow, a solidarity march for people who are seeing what's happening in the US in terms of the racial unrest. And I guess I'm just wanting to know from you what, people are going to gather. There's going to be a group. What do they need to do to protect themselves, maybe beyond the mask and trying to keep a distance, which might be difficult in a large group?
Thanks for the question, Kate. So, yeah, our citizens have the right to peaceful protests, and this is a very important matter. There continues to be a provincial order in place restricting gatherings beyond 5 people, and there is a public health reason for that. I understand there may be thousands at this event, that organizers have asked those who come to maintain physical distancing and wear masks. The larger the crowds, as you mentioned, the harder it will be to maintain physical distancing. Such large gatherings are high risk. So I am worried. I would ask people to carefully consider the impacts, especially if they care for or live with people who are vulnerable. The people we most often pass our infection to are the people we are closest to. And if people are going to participate, I would recommend that they self-monitor themselves for 14 days afterwards.
And then a similar question then for either Chair Redman or Mike Murray. I think you said he's on the call. I don't see him right now. Given that there is a provincial order not to gather, what does that mean for the region? What actions does the region take, if any, regarding this protest?
Karen, do you want to start?
Okay, sure. I take it, Kate, you're really asking what level of enforcement will be on hand for this demonstration. And I would just reiterate what Dr. Wang said, which is that people have the right to peaceful demonstration. There is a convergence of two huge issues. One of them is the pandemic that we're all living through, and the other are very serious allegations and a demonstration that we need to be inclusive. We need to not tolerate racism or discrimination of any kind. So I would have to tell you that while people have the right to peaceful demonstration, we have huge concerns of a gathering of that size. So I know if I were wearing my Waterloo Regional Police Board chair hat, I would tell you that the police are doing everything they can to facilitate a safe and peaceful demonstration. People do have a right to assemble. They do have a right to have peaceful demonstration. It's very, very concerning in a time of pandemic. As Dr. Wang said, we really worry about a second wave coming with this massive numbers of people gathering. There is an opportunity to participate online, and we would encourage people to voice their support in solidarity of these issues by joining online rather than deciding to come in person.
Yeah, I don't have anything to add to that.
Okay, and just quickly for Dr. Wang, how long after this, would it be about a 2-week period before people who attend an event like this would see symptoms if they do contract something?
Yes, up to 2 weeks.
Thank you very much. I'll end there for now.
Great. Thanks, Kate. I will pass it over to Damon. Go ahead, Damon.
Could we come back to me? My questions have been answered so far.
We sure can. Okay, I will. Sorry about that. How about Joanna? Go ahead, Joanna.
Oh, most of my questions were asked too, but just, I guess, more specifically, will there be public health officers or police or bylaw officers out at the march enforcing the emergency orders?
Every indication I have gotten from the chief and Waterloo Regional Police Services, Joanna, is that they will be on hand to make sure that it is a peaceful, orderly demonstration. So they're working with the organizers to make sure that while people want to sort of come out in solidarity, that it is a peaceful process. So my understanding is people will not be on hand to write tickets, but they will be on hand to make sure that it's peaceful and there are no infiltrators or agitators. People truly are there to express their solidarity for Black Lives Matter.
Okay, thank you.
Okay, I will go down to Nicole. Go ahead, Nicole.
Hi, good morning. Moving on to the cases that we're seeing, are, like, you said they were in line with, general population testing, what you were expecting. Are they also in line with the easing of restrictions?
I think it may be too early to be certain of that. We'll have to continue to monitor. We had until recently been seeing very low numbers, but I was expecting with the increased testing, we would see increased numbers. And we'll have to see to what degree the numbers increase. There is a continuing level of circulation of COVID-19 in our community. And, we'll see in the next several days what will come of all the increased tests that we've done in terms of what it's telling us in regards to community circulation of COVID-19. We're also seeing, as I mentioned, workplace outbreaks being detected. So that also has an influence on the numbers.
Are you able to say what manufacturing / industrial facility has the outbreak? Are you able to provide the name?
Not the name. I won't be providing the name, but I'm just going to indicate hold on a second, I'm just going to pull up the dashboard because we have classified them under general category of workplace. So there are currently 2 that are active, one of which is in food processing, and the other is in manufacturing.
The food processing one, that's the one that's declared over. That's Conestoga Meats, correct?
Yes, there's actually one that's declared over, Conestoga Meats, and there's one that's active.
Okay, and that's the manufacturing and industrial one. That
No, it's a food processing one. So there are so if you look on the dashboard, so on the food processing row, you have one that's currently active and one that's declared over. But the 91 cases of the Conestoga Meats outbreak, which has been declared over, is among the 105 total cases that are among food processing plants.
Oh, okay. So there's another one outside of Conestoga Meats.
Yes.
Okay, thank you for that. Last week, Toronto put out a heat map of positive cases in that city, breaking them down by community. Wellington, Dufferin, Guelph Public Health has confirmed to us that they are doing something similar in the works and will be releasing that to the public soon. Is Waterloo Region planning to do the same? If so, when? And if no, why not?
I can tell you that we are looking at it now. So I don't have anything more to share at this time, but we are looking into it now.
Okay. And we know, I don't know if you're aware, but there are a number of confirmed cases at Scotland Farms in Norfolk County. Are you concerned about the migrant farm worker population here in the region? Have you been in contact with farms locally?
We haven't had an outbreak detected in those settings. They're definitely more vulnerable settings. There's been guidance provided by the province for such settings, and we will continue to monitor. Yeah, they're definitely vulnerable settings.
I guess this next question is for Mike Murray. Last week, towards the end of the week, the Premier says that they will now leave it up to each region when it comes to the easing of restrictions. Are you able to provide us, where the region is in terms of this?
Nicole, it's a good question. I'm not exactly sure that that's what the Premier said. I think they talked about contemplating a strategy that would have differential opening in different parts of the province. I'm seeing Dr. Wang nodding. I think that this is an ongoing and evolving issue, and I don't think that there's clarity yet about what the provincial strategy is going to be, whether it's going to be uniform across the province, which it has been to date, and frankly, that's how it is today. They have the emergency orders that are in effect right across the province. And so until that changes, our latitude to do things differentially here in Waterloo Region is extremely limited. So I think this is still a live issue, Nicole.
And I have one more question. Given that there is a provincial ombudsman that has announced an investigation into the government's response to COVID-19 in long-term care, how would you comment, Dr. Wang, in response to the locally facility outbreaks?
Yeah, I think, my understanding is that's a review that the ombudsman will be conducting of the provincial response. I think, what we've seen in Waterloo Region is what we've seen elsewhere in Ontario too, which is that, there are some system issues across the sector. They don't affect individual homes in the same way. There are differences between homes, but if you look at the sector overall, it's I think this pandemic has highlighted some areas in this sector where there needs to be some further support. So, I'm looking forward to seeing any results of reviews that are done, et cetera, of the situation.
And is Forest Heights still in the red?
Yeah. Yeah.
That's it. I'm good. Thank you.
Thanks, Nicole. I'll pass it over to Tim now. Go ahead, Tim.
Dr. Wang, with increased testing, how has that been going for public health and your partners?
Well, thanks for the question. So the testing is done by our testing partners and is overseen actually by the assessment centers. So it's not done by public health. But, obviously I am happy with the fact that, there's a lot of people that are taking, taking the initiative to go and get tested, and that our testing volumes in the region have been good since the testing has been broadened to include a lot more people. Yeah, so it's a good sign.
Okay. And with the outbreaks, the congregate settings, there is currently 1 active, 2 are declared over. And with the peaceful protests going on, you mentioned 2 weeks from now, numbers may increase. Would these peaceful protests be a part of that, if that was possible to increase the numbers?
Yeah, no, it's definitely possible that if there's increased circulation in our community, that there could be increased risks to our congregate settings, to our long-term care and retirement homes, because those infections do come from the outside in to those settings that are closed. So definitely, what the risk to our congregate settings in the region is impacted by the overall circulation of COVID-19 in our community.
Okay. And for food processing, is with outbreaks there, is there something to do with the process of how it's food, like, or is it just because there's just so many people in such a small space? Is that the main reason why there's always outbreaks in food processing?
Yeah, that could very much be the case. I mean, every single case may be a bit different, but what we've seen to date in outbreaks in such settings are factors such as, not optimal physical distancing, not optimal use of PPE, and in all outbreaks, there are occasions where people work when they're sick and they're spreading it. So those are the types of common factors that we see in outbreaks, and there are certain industries that may be more predisposed to having greater risks in those areas, like physical distancing. And so that's why it's important that public health works with the Ministry of Labor, who has oversight over workers' health and safety in such workplaces, and would really know best what is needed in those workplaces to continue to protect workers' health and safety. So we're there to provide support with outbreak management, and we'll be working closely with the Ministry of Labor on any workplace outbreaks.
That's great. Thank you, Dr. Wang.
That's also why we're tracking by workplace setting, because it will give us an idea of if there are particular settings that are at greater risk in our region as well, and if there are some common factors. We'll see this a little bit over time.
Thanks, Tim. Thanks, Dr. Wang. Okay, I'm going to circle back to Damon. Are you ready now, Damon?
Yep. So this is a question for Dr. Wang, and I'm not sure if you'll be able to touch on this, but say if you're at a place of employment and your employer says you're required to wear a mask, and for some reason you can't, and is there a requirement still, or is that, I don't know how to word this, if you know what I'm trying to say.
Yeah, I think I know what you're trying to say, Damon. Thank you.
Is it's recommended by
I can't speak to that because it's workplace health and safety, and the workplaces will need to determine their policies. But I can say that, you know, I recommend anytime people are not able to physically distance, or rather, I recommend that unless they feel they can physically distance, if they're around others, that they wear a mask if they can.
Okay. And for community spread, how do we believe these numbers are still going up and continuing? Is this mostly through these congregate settings, or?
No, I think it's mostly through people spreading it to close contacts. And that's just happening in our community. Most of the time, that's what we see. It's not the casual contacts, it's the close contacts, whether in a family setting or in a setting of people who socialize together, or in a workplace setting. It's most often close contacts. It's most often people that have symptoms, that have, you know, continued to socialize when they're symptomatic. So that's generally what we see. We'll see little clusters like that in the community, and that's what contributes to our numbers. And in certain circumstances, either in a long-term care home setting or in a workplace setting, if there's some spread, then it will grow, and it can grow relatively rapidly. And so that's also a cause for sometimes some of the numbers increasing, quickly. So it's something that, as I have mentioned before, we have to be very, very vigilant. We have to continue to stay the course. It is something that can, continue to something that can, there's always this possibility of spread, and it can be something that just rises very quickly. So as a community overall, we can't let up. I know it's been a long time, and people may be tired of the measures, but we have to think of it as our new normal, that we have to always keep physical distancing, hand washing, staying away from others when you're ill, and getting tested. We have to consider those as the foundations of our new normal. And so I really would just continue to urge people to keep that in mind in everything that they do, to help protect themselves as well as those that are close to them. Yeah.
Okay. And then out of the 167 active cases, it shows us the amount that are hospitalized, but it doesn't break down between, like, say, someone who's just at their own property or long-term care or retirement homes. Would you be able to give us that estimate?
I think what we find is, hold on a second here. I'm just going to see if I can. Under our current case status, we have, just trying to, sorry, just total of 16 cases that are hospitalized. And of these, 11 are related to outbreaks.
Okay.
Yes.
Perfect. Okay, I got it now. Thank you so much. That's all my questions.
Great. Thanks, Damon. Okay, I will pass it on. I believe we have 2 more people, so I will pass it to Irene. Go ahead, Irene.
Hi, my question is for Dr. Wang. Is there a significant percentage of people who have tested positive who are asymptomatic?
I don't have that number off the top of my head, but what I can tell you is Generally, we see that in circumstances where there's been spread, as opposed to sporadic people that are asymptomatic that have the infection, right? It's generally if we have an outbreak situation and we've seen evidence of spread and we do testing, we'll pick up asymptomatic cases. And where there's no evidence of spread, we rarely pick up asymptomatic cases. So the trend that I'm seeing is, yes, there can be asymptomatic cases. Oftentimes what happens is the people test positive and then a couple of days later they develop symptoms. So it's like an early precursor to symptom development. That's kind of the trend we've been seeing. So it's more in line with situations in which we have some other evidence of spread that we're more likely to see others test positive, even though they're currently asymptomatic at the time of testing. And these people often go on then to develop symptoms. So it seems to be overall a tool to detect it a little earlier.
Okay, and one more question. Do you know if anybody who's tested positive in Waterloo region is being asked to donate a sample for testing antibodies toward a vaccine to the virus?
No, I'm not aware.
No. Okay, that's it. Thank you.
Thanks, Irene. I will pass it over to Kevin. Go ahead, Kevin.
Hi, as Nicole mentioned, the Premier floated the idea of opening regionally last week, and then yesterday he brought it up again a couple times.
Sorry, could you repeat yourself? I'm sorry, I couldn't hear that part, Kevin. Sorry. What did you
well,
say?
this is going to be for Karen and Mike.
Oh, Karen and Mike. Oh, sorry, perfect. Okay, good.
So the Premier floated the idea of opening regionally last week, and then brought it up again a couple times yesterday. He said he's been in touch with elected officials and local leaders from across the province. I was wondering if you guys have had any discussions on the subject so far.
So I would tell you that I was part of a Marco meeting, as was Mike last Friday. That's the mayors and regional chairs of Ontario. And there's real apprehension about having a broken front, as much as it's frustrating and people are getting sort of a bit of pandemic fatigue. There are other issues, if you were to speculate, and that's all it would be at this time, what a regional opening might look like. So I think most municipal leaders see a lot of unanswered questions when this is raised. So there was discussion about it with the minister, not the Premier at the time. It was Steve Clark, and real concern about what that might look like. There have been areas where you can think of where provincial borders come together, and they have come with some very unique issues of enforcement. So again, really probably not worth speculating until the minister and the province comes out with specific guidelines about what that might look like.
Okay, thank you.
Anything further, Kevin?
No, that's it.
Great, thank you. Okay, I'm going to take a look and see if there's any final questions. Give me a wave. I see Kate, I see Joanna. Okay, we'll start with Kate. Go ahead.
Thank you. Back in April, Dr. Wang, you were able to give some projections because the province had provided numbers to you. Given that the warmer months are ahead of us, there is sort of a thought out there by some people that the virus kind of goes away when it's hot. Do you have any sense of when you might have more projections for the next 3 to 4 months when the province might be providing that to you?
No, I don't have any sense at this time, but I understand it will come. Just don't know when.
And just sort of to touch on the heat aspect of the virus, I know health officials are still learning about it, but what are your thoughts on that?
It's hard to say. I think this is a case where we're going to only be able to really see in hindsight how it's progressed. It will, yeah, I don't know at this point.
Thanks, Kate. Joanna, do you have a follow-up?
Yeah, just a question probably for Mike Murray. Will we continue to get an update on enforcement and compliance activity in the region, and when will that be?
Yep, Fridays. Well, so we've been doing them once a week on Wednesdays, so we'll do them once a week on Fridays.
Great, thanks.
Okay, I think that's it for questions. Oh, I see Damon and Nicole. Okay, Damon, go ahead.
Okay, just a quick one for you, Bethany. If numbers keep on increasing, will we move back to 3 sessions a week?
I think that will be a conversation for a bunch of people, and we are definitely able to quickly move up to 3 a week if we need to, and we would give you guys lots of notice.
Perfect, thank you.
Okay, and Nicole?
Yeah, this is a question for Mike. Where are you in terms of the discussion in regards to making masks mandatory on buses? Because we just recently saw Pearson make masks mandatory within the airport. So with Ottawa doing that for their transit services, now at Pearson, you said that there was a discussion going on. Where does that stand?
Yep, and Nicole, the answer is going to be the same as I provided last time, which is making or attempting to make masks mandatory is a really challenging and tricky issue. It's easy to say. It's much more difficult to put that into practice and enforce it consistently. And so those are some of the issues that we continue to explore. And one of the things that we're monitoring is we're encouraging people to wear masks, and we're just going to monitor what that looks like. We've also put in place, and mask wearing is to try to keep people safe, to keep it's basically to keep others safe. And we've put in place some measures on the buses to try to make sure our operators are safe, and that operators and passengers aren't impacting each other. So it's it's a live ongoing issue.
Okay, anything further from anyone else? I don't see anything, so we can wrap it up. Thanks everyone for joining us and helping us share these important messages, and we will see you on Friday. Bye-bye.
Thank you.